There you go. All right, we're gonna get started.
Okay, let's get started.
I'm so excited. Okay. So hi everyone. Welcome back to the Arm Hug podcast. I am Henna Stislow, CEO of Arm Hug, and I am here with an incredible inventor and CEO, Abbi Jones. She's got a product for us. It's called E-copi and it's by Medpaper. And the reason she just told us a little bit about why it's her company's called Medpaper is because there are going to be so many other products that she's thinking about made out of paper. So you need to see it to believe it. So I'm going to take it over to you, Abbi, to tell us a little bit more about this idea.
Yes, and I'm sorry, I did bring my dog to work today. And so if you hear a little background noise, that's my little puppy running around. So, yes, I'm Abbi Jones, the inventor of E-copi, and have a crazy background that does fit into this. I was a high school science teacher for a while, switched pharmaceutical cells, which is a weird switch, but still kind of in that science world. And when I switched to pharmaceutical cells, I called on OBGYNs. And so I sold birth control and iron and things for OBGYNs. And at the same time, I was having my own 3 children. And I knew as my belly grew, I could not hit the cup to save my life. You know, ladies, when they hand you the cup and you go to the bathroom and they expect you to collect a urine. To tell you the truth, I have a hard time leaving a sample without being pregnant, but as my belly grew, it was a disaster. And so I really thought it was just me. It's kind of this unspoken issue that women just kind of suck it up and deal with. It's just like, I mean, what are we going to do? So we just deal with it. But when I was calling on 120 pharmaceutical OBGYN offices as a pharmaceutical rep, I realized it was not just me. It was almost every woman, every age, every size, and every single office. And I was asking the staff, I was like, is this a problem for y'all? And they said, yes, it is. It backs up our day because we're constantly cleaning up after people. There's urine on the walls, even on the other floor. It's so gross all over the cup. A lot of women even drop the cup or they miss the cup completely. So we have to hand them a cup of water and they have to go back and drink the water until they can try again. Sometimes that takes 2 or 3 times. So the lack of efficiency in the office is a disaster in and of itself. Never mind the frustration of the patient trying to get back to work or whatever they need to be doing, just because they can't hit this cup. And I honestly thought, that's the stupidest thing I've ever heard. As such a progressive country and world we're in, how is it that we're still handing women a cup? And that's when E-copi popped in my head. I'm telling you, I can tell you the exact office where I was standing when this popped in my head. And we call it E-copi because it is eco-friendly. And obviously, P has to do with urine. And so the cup just goes right into this lower part and it fits any lab cup out there. We designed it with these slits right here because
Okay.
some cups are a little bit bigger and thicker, and this is a small pediatric cup. And so you just close it on top and you can sit on it. You can stand and hover over it. A caregiver can put it underneath the patient and there's nice space between the hand and the genitalia area, or a parent and their child. And it streamlines the urine right into the cup. And then you just pull it out and turn it in. And then this is basically a glorified paper plate. I mean, you can see, and you just throw this away. And this is biodegradable and it breaks down in a landfill in about 24 months. So, E-copi. And as I said before, I've really designed this with women in mind. But as we have been through different trade shows and trials, really, this has become huge in pediatric space, elderly care, caregivers, disabled patients, the VA. I'm sorry, my dog is just um, the emergency department. Because when people go to the emergency room, they're either injured or
Yeah.
really or dehydrated or dizzy. And again, they hand you the cup and you're like
Yeah.
and they're trying to find out what's in your system and your body so they can treat you. And so handing somebody an E-copi instead of putting a catheter in a patient is the movement that we're trying to get to in the medical world. So I know I've just said a whole lot, but that is the in and out of E-copi and this simple funnel, this simple solution to a huge problem that I think we can all agree is pretty dumb. And so that's it. This is E-copi.
Yeah, that's amazing. So I guess I want to ask a few questions on where can people find you today? Is this something where you're on a website? Are you attending
Yes.
conferences? Are you talking about it? Yeah.
Oh, yes. Oh, yes. So ecopi.health is where you can find us, and you can actually, we're on Shopify, so it's all over our website. So you can actually click and buy a pack of 20 for yourself. So I actually have pregnant women who will go online and buy a pack of 20 to get them through their pregnancy. Or I have some young girls even who have some kidney problems, and they have, once a month or whatever, and they'll go online and buy some, for the year. So you can do that. We are starting to get into some hospitals, into some OBGYN offices. So the hope is that really soon you'll be able to walk into your OBGYN offices or your hospital, your clinician, their office, and you'll see it there for you. But until then, you can definitely go on our website and order.
Okay. And then I think that was going to be my next question is any struggles that you're having getting it out there, right? You're already talking about like going into offices and hospitals and to get any medical products there, it's really difficult.
It is so difficult.
Yeah.
It
There's
is.
a couple
I
things.
say all the time, I wish I had just invented Crocs because it is such a big product and it's
Get
just
it.
direct to consumer. The medical industry, I think my next line of work is going to be somewhere in politics so I can cut all the healthcare problems, because truly, 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 to get something this simple into the medical industry is the hardest thing you've ever had to do. But I will not stop, and I'm going to continue. This is not a luxury item for women and children. It is a necessity. It is just baseline dignity and baseline need for a woman to have a better experience
Mhm.
for themselves at a doctor's office, and it makes sense. Um, so, FDA clearance, reimbursement, we've been battling the reimbursement. Um, so all of that is difficult, but you can get there. And
Yeah,
so you just have to keep pushing, have to keep trying. And basically, the people who win in the medical device game are the people who just don't quit. So that's the game. That's the game. You keep,
no lies. Yes,
yeah.
it's so true.
And somehow you have to keep your sanity and not quitting. But now we're getting into the VA. We're getting into these niches that are really creating a stir and getting that word of mouth. So that's been really helpful. So
That's great. That's really great. And then I guess, are there any specific resources that you recommend to people who, want to start things like this? You mentioned other products. What does it look like for you?
yeah, so I do have other products in mind. I want all my products to be made with paper. I just think that there's such an opportunity to have a space in the medical field that's eco-friendly to cut down on that plastic carbon footprint that we're making. There is such a opportunity for us to do that. But again, it's hard. But I think if you keep pushing and keep getting in front of the right people with a good story and good marketing, you can get there. For somebody just starting out, I would say really have your story nailed down. Really understand the value you're bringing and the solution you're bringing to the problem, and people will listen. Is what I've when I paint a picture of what it's like for a woman in a bathroom, and I'm in front of a lot of men, and they are like, "This is an actual problem. Wait, I don't understand." So sorry. So
So cute.
I'm constantly painting a very, very clear picture to a room full of men why this is a problem for women. And by the time the meeting's over, they're like apologizing. They're like, we're so sorry. We're so sorry. We'd had no idea because they don't know. Nobody talks about it. And
Yes.
we have to start talking about it. We have to explain the problem, so people can hear it. So that's my piece of advice. I'm so sorry.
Oh, I'm trying to think like anything that anybody listening can do for you. Like, how do we spread the word? Are there other initiatives, foundations, anything that help with this
Just any
thing?
kind of women's health. Actually our social media, we've had some things go viral. Um, any kind of word of mouth. I think social media is the loudest voice we have right now, and just sharing it, partnering. If you have a device that you're wanting to get out, we can partner, do some promos and help each other out. I think that's really powerful right now. Um, and just I would say that. I would say helping each other out and using the power of social media right now.
That's awesome. And I
Yeah.
have to ask, so I mean, you have your product out there. What's the feedback been like? What are the women saying? Like, obviously, they're ordering from you and whatnot. Um,
Where has this been? Why has this taken so long? What is happening? Why why has this taken so long? And why is it taking you so long to get it out there? What's the holdup? And I wish I could I wish I could tell you, but it's just, you know, that would be such a long road to go really try to dig out what's wrong with our healthcare system. But it's money, and E-copi costs about 70 cents each, and so for them, they're like, do I really want to spend 70 cents per patient? To me, yeah. And I can bring the value. I can even bring the value monetarily to your office of how that 70 cents is valuable. But to some hospitals, they're like, well, to us that's still dollars. So it's just pressing through that barrier of them understanding the value of writing this extra check, but what you're getting in return. And what you're getting in return is a better run office or a better run hospital, lower
right.
contamination, lower repeat urinalysis. Um, that the value's there. I just have to kind of let them hear it the way they need to hear it. That makes sense. And sometimes that takes 2 or 3 conversations, not just one.
Right. Or 2 to 3 months or
Right.
years.
Or 7. Uh, and that's what I learned in my pharmaceutical days, is that I would talk to a doctor for a year about
Yeah.
the same product. And then after a year, they're like, you know what, this product's really good. And I'm like, oh my God, I've been talking to you about this for a year. You just heard me. Like, what did I say different? But that's just the way it is.
Or sometimes they're like, a lot of people have been asking for this. And it's like, cool, because I've been here.
I've been here the entire
Right. Oh, goodness. I think it's great though that you did decide to do the the switch between science teacher and farmer sales, because now this is helping you take this to the next level, which is really exciting.
Yeah, it's really amazing how all things kind of can come together and work together, and really propel you for your next phase in life. So it has, you know, your life journey always ends up making sense somehow. When you look behind you, you're like, oh,
Yep.
what
It never makes sense going forward. It makes sense going back.
makes sense looking back. Yeah, this just prepared me. So yeah, we're in it. We've been going, I secured investors 3 months before COVID hit. So it was bad timing, but really and truly, it allowed me to really lay a really firm foundation, because obviously no hospitals were going to talk to me during those first 20 months. But that's okay, because I got my device right. I got my patents right. I have 17 patents all over the world, because there is nothing else anywhere in the world like this. And
So,
I mentioned before, I had some things go viral, and I had some women reaching out to me in Europe saying, please get this over here because they hand us the lab tube, the half diameter
Oh,
lab tube to leave a urine sample in. What?
that's crazy.
I'm like, what? And they're like, yeah, like they hand us the lab tube. We really need this. And so I patented all over Europe um, to try to get it over there. And I'm working with some distributors over in Europe to get it over there as fast as possible. But I had a woman out in Philadelphia reach out to me. She said, well, my doctor hands us the lab tube as well. I'm like,
Yeah.
oh, this is barbaric. I, this is not okay.
Yeah.
Um, so it's these kind of things that I'm just screaming from the rooftop. Like, in what world is this okay to hand a
Yeah.
woman? So
I don't even know how their success that doesn't go well.
no, that can't go well. And again, it's being in these rooms. And look, I have two sons. I love my husband. I love my sons, but men just don't get some things. And this is one of those things. Like when you really, I enjoy being in rooms of men and really breaking down the anatomy of a woman and saying like, fellas, this we can't do this.
Right.
It's hard, and especially you hand a woman a tube, it's over. I don't even understand how that
I know. I would just like laugh and be like, "You're kidding."
yeah, this is not going to work.
Yeah.
No.
I'll just get my own cup. I'll just buy a cup, I
Yeah.
guess, at this
Yes.
point.
I'll go to CVS and I'm going to buy a cup. I'll be right back.
Yeah.
Yeah. So that time during COVID really helped me to lay that groundwork, to get a trademark, grow my, get my branding right. So that when I was able to finally get back into hospitals and get back in front of people who were finally had the bandwidth to listen to new products, we really had everything, really tight and ready to go. So it ended up again being a blessing, being something that we were like, oh, okay, well, that really made sense for us to, be able to do. So uh,
So, what's the next few years look like for you?
the next few years is continuing to build up E-copi, um, and then start on my second and third devices, which I've started provisional patents for. And so hopefully E-copi can take off and run. And then my second one will be right behind it. And then my third one will be right behind that one. Again, made with paper, providing a solution to a problem that's out there, by keeping it eco-friendly. And so that Medpaper will just be this company that people know you're getting great products that are providing a solution, but are also eco-friendly. So, I mean, there's a big green initiative going on right now in the United States with hospitals, within the VA, with federally funded, medical world, all of that. It's really there's some big green initiatives. So I think it's going to catch the attention of all of those people. I'm also a woman-owned business, so that catches people's attention to just having that minority certificate. So hopefully we can just keep moving on, and I can just beat down these barriers now and open up doors so that my second and third devices will be a lot smoother than this first one has been.
Oh, yeah. And I guess like that leads to my next question about your team. Do you have a
Yeah.
large team? How do you manage doing
Uh,
all of this?
no, you're looking at the team. I mean, I have some team members. I have a team of my investors who are awesome and amazing. And within those investors, I have a CPA, I have an attorney, but like I have a team of like 7 attorneys: FDA attorney, business attorney, trademark attorney, patent attorney. I have all these attorneys, and then I have a lead CFO. A lead CLO, and so the lead legal officer. And so, um,
Wow.
it's just a lot, but my team of investors really have come around me and helped me. I don't have a business background,
Right.
but they all do. So they are able to sweep in and really help me. But as far as like marketing, branding, you're looking at it. So we have had groups of 1099 reps out there that I manage and look over and after, but now we've just started partnering with other firms and they kind of do it. And I just train them and then they go on and do it. So
Nice. Nice.
Yeah.
That makes sense. That makes sense. Yeah, because I mean, I completely understand small team. I mean, also it's like having to pay all of these legal things that you're already doing. On top of that, I can't imagine like what it's like to pay yourself and then think about paying another group of people.
Oh
It's a
no, it's a lot. It's a startup. Oh no, I haven't been paid. But I mean, people are like, oh, and I'm like, I listen, you do this for the love and I'm believing in this. I'm not doing it for any other reason. There's no money. There's no, not yet, but I'm
right.
believing that. I know that if I keep going, something will happen. Either somebody will come buy my product or buy E-copi, which would be awesome.
I feel
Or
like you
that
should be in like pharmaceutical places. That's crazy.
I know. So I'm really open to anything at this point, and just seeing what lies ahead, so I can jump on to product number 2 or 3.
Okay.
Um, so I'm pretty much open to anything. But
That's exciting. Well, thank you so much. I mean, that's all the questions I had because I wanted to make
okay,
sure and get your story out there because what you're doing is super important.
I'm so glad you reached out to me.
Yeah. I was like, wait a second. How long have you been doing this, by the way?
4 years.
4 years. Look at you. 4 years and I found you. So, I mean, you're doing something. It's getting out there. It's getting
Getting
let's
out
get you
there.
out
I'm
there.
so glad you found me, and this was fun. Thank you
Yes,
for having me.
of course.